Internal Carotid Artery Anatomy. Welcome! In this video, we'll cover the internal carotid artery, its course, branches, and clinical importance, along with key veins of the head and neck. Let's begin. Internal carotid artery. The internal carotid artery is one of the two terminal branches of the common carotid artery, but it is more direct. It is considered as an upward continuation of the common carotid artery. It supplies structures inside the skull and in the orbit. It is the principal artery to supply the brain and eye. It begins as the upper border of the lamina of thyroid cartilage at the level of the discs between C3 and C4 vertebrae, and runs upwards to reach the base of the skull, where it enters the carotid canal in Petrous temporal bone. It emerges in the cranial cavity by passing through the upper part of the foramen lacerum in the cranial cavity. It enters the cavernous sinus and pursues a tortuous course before it ends below the anterior perforated substance of the brain by dividing into anterior and middle cerebral arteries, parts. For the sake of convenience, the course of the internal carotid artery is divided into the following four parts. Cervical part. It ascends vertically upwards from its origin to the base of the skull to reach the lower end of the carotid canal and lies on the front of the transverse process of upper cervical vertebrae. In the neck, the internal carotid artery is enclosed in the carotid sheath, along with the internal jugular vein and vagus nerve. Branches. In the neck, the internal carotid artery gives no branches. Petrous part, the internal carotid artery, enters the petrous part of the temporal bone in the carotid canal. It first runs upwards and then turns forwards and medially at the right angle. It emerges at the apex of the petrous temporal bone in the posterior wall of foramen lacerum and passes through its upper part to enter the cranial cavity. Branches, carotid-tympanic branches, to middle ear, which anastomose with the anterior and posterior tympanic arteries. Pterygoid branch, small and inconsistent, enters the pterygoid canal, and anastomoses with greater palatine artery. Cavernous part. This part lies within the cavernous sinus. From foramen lacerum, the internal carotid artery ascends and enters the cavernous sinus. In the sinus, it passes forwards along the side of the sella tarsica, in the floor and medial wall of the sinus. Branches. Cavernous branches to the trigeminal ganglion. Superior and inferior hypophyseal arteries to the hypophysis cerebri, pituitary gland. Cerebral part. This part lies at the base of the brain. After emerging from the roof of the cavernous sinus, the artery turns backwards in the subarachnoid space along the roof of the cavernous sinus and lies below the optic nerve. Finally, it turns upwards by the side of the optic chiasma and reaches the anterior perforated substance of the brain, located at the beginning of the stem of the lateral sulcus of the cerebral hemisphere. Here it ends by dividing into anterior and middle cerebral arteries. Clinical correlation, carotid siphon, the U-shaped bend, formed by the internal carotid artery, while passing through and above the cavernous sinus, is called carotid siphon. It probably dampens down the pulsations of the artery. The carotid siphon is an important feature to be seen in the cerebral angiography. Veins. The major veins draining the head and neck are subclavian, internal jugular, external jugular, and anterior jugular veins. The valves in the lumen are mostly absent in the veins draining the head and neck area, unlike the rest of the body. This leads to two-way flow of blood, dictated by local pressure changes. For this reason, infection in the head and neck area can lead to serious complications. Subclavian vein. It is the continuation of the axillary vein and extends from the outer border of the first rib to the medial border of the scalenus, anterior, where it joins the internal jugular vein to form the brachiocephalic vein. The subclavian vein is principally the vein of the upper limb. The subclavian vein forms an arch across the pleura at a level below the arch of the subclavian artery. These two arches are separated from each other by the scalenus anterior. Tributaries. The following are the tributaries of the subclavian vein. External jugular vein, dorsal scapular vein, thoracic duct on the left side, and right lymphatic duct on the right side. Anterior jugular vein, cephalic vein, only sometimes. Applied aspect, subclavian vein catheterization. The subclavian vein is located immediately posterior to the medial third of the clavicle. It can be catheterized both from below, infraclavicular approach, and above, supraclavicular approach, the clavicle. Subclavian vein thrombosis. It can be spontaneous, primary, or secondary. Clinically, it presents as edema of the upper limb, especially after exercise. The primary thrombosis occasionally occurs due to excessive and unaccustomed use of the arm at the shoulder joint. The secondary thrombosis occurs as a complication of an indwelling venous catheter. Internal jugular vein. The internal jugular vein is usually the largest vein in the neck. It begins as a direct continuation of the sigmoid sinus at the base of the skull, below the jugular foramen, and descends vertically downwards to end behind the sternal end of the clavicle by joining the subclavian vein to form the brachiocephalic vein. The internal jugular vein drains the brain and most of the tissues of the head and neck. The right internal jugular vein is usually larger than the left because it drains the blood from the larger superior sagittal sinus, CF. The left internal jugular vein drains blood from the smaller inferior sagittal sinus. At the lower end, both the internal jugular veins, right and left, tend to shift to the right so that the right comes to lie further lateral to the right common carotid artery, while the left tends to overlap the left common carotid artery. Tributaries. Inferior petrosal vein is usually the first tributary and joins the internal jugular vein immediately below the jugular foramen. Pharyngeal veins from pharyngeal plexus, common facial vein. Lingual vein. superior thyroid vein, middle thyroid vein, occipital vein, only sometimes. Carotid sheath. The carotid sheath extends from the base of the skull above to the arch of the aorta below. At the upper end, it is attached to the margins of the carotid canal and the jugular fossa. The upper part of the carotid sheath contains internal carotid artery, internal jugular vein, and last 4 cranial nerves. Medial to it lies pharynx. Lateral to it lies styloid apparatus. Anterior to it lies infratemporal fossa, and posterior to it lies cervical sympathetic trunk on the prevertebral fascia. The lower part of the carotid sheath contains common carotid artery, internal jugular vein, and vagus nerve. That's a quick overview of the internal carotid artery and major veins. Thanks for watching. Don't forget to like and subscribe for more anatomy videos.